and good afternoon. It's Nafisa, nurse with Excelsior University. I am doing my Module 6, Outcome Achievement Video Reflection. And so for this week, everything has been going well. Just trying to finish up some assignments and my VATIs. I've been working a lot in my first job and second job, so I'm just trying to get the time to complete those, but I will get those completed. So thinking back to clinical practice experience where you integrated evidence-based practice into your patient care routine, I would say with both clinicals, in 250 and in 290, I would say an evidence-based practice that I integrated would be hand washing, which is something that is needed when you are in healthcare, whether you're a CNA, a LPN, or RN, patient. Just in general, hand washing is the number one way to get rid of germs and to help the spread of bacteria and diseases. So I would say while at clinical, it was very important for us to do hand washing when we entered the room and after we assessed our patients, taking vitals, changing linens, washing the patients. It was always important to wash our hands afterwards as well. So that would be the most best possible outcome to have while in clinical is just to make sure that you are adhering to hand washing with all patients using standard precautions unless otherwise stated. How did it make you feel, your emotional state? How did you feel about this situation? Again, I know as a nurse, hand washing is the first and priority way of preventing germs and spreading germs and bacteria. So it's very important to incorporate that when dealing with patients. Did this situation make you feel good or worse about being a nurse? No, it just it made me feel good. Again, I know that not only am I protecting myself, I am protecting my patients and other staff. That's why it's so important to implement hand washing when you are in healthcare. Why did it happen? Make sense of the situation. Did the situation go well, or was there any room for improvement? It went well. Again, I make sure that I washed my hands before entering a patient's room and when I was leaving the patient's room. Even when I was giving medications, I washed my hands before and after. Hand washing is just something that is important and needs to be done. Is there anything you could have done to improve the situation? No. I believe that we are taught in healthcare and as nurses to always do hand washing. Yes, sometimes it is okay to use hand sanitizer, but hand washing is going to be your best friend. And again, making sure that everybody stays safe and healthy. What knowledge, skills, or attitudes would you need to better manage a situation like this? Nothing unless hand washing calls for like a surgery or some type of procedure, then hand washing may be done a little differently, but in the typical workplace at the hospital, health center, regular standard hand washing just will suffice. How has this situation made you a better nurse? It's just, again, just a reminder that it's important to make sure that you wash your hands to make sure that everybody remains healthy. That's the bottom line, and to help prevent any type of diseases or viruses, and to make sure that you enforce it with your staff, yourself, patients. It's just very important to incorporate that. Is there a person who helped in this situation that may have gone unnoticed or unacknowledged? Nope. Everybody that I was with during those both clinicals were wonderful, from the instructors to the teachers to the nursing staff. It was just a great experience overall. Thank you.